Welcome to your 2022 benefits enrollment. As a new hire, you are eligible for benefits on the first of the month following 30 days from your date of hire. You're eligible if you're full-time or part-time, working at least 20 hours or more. So the benefits I will go through today will be based upon your new hire effective date through July 31st, 2023. All elections are for the full plan year. You can make changes based upon a qualifying event. The only exception to this full plan year is for our healthcare FSA. It is based on a short plan year. So your election will be based upon your effective date through December 31st. And then we will move to a calendar year basis for the healthcare FSA. So once you make your elections, you cannot make changes during the year unless you experience a qualifying event. If you get married, have a baby, if your spouse loses coverage and needs to come onto your plan, be sure and contact HR and make your change within 31 days of the qualifying event. And that is an IRS regulation on the time frame and not an employer rule. The exception to that is if it's a change in eligibility for Medicaid or CHIP, then you have 60 days to make your change. So today we'll be going through all of the benefits that are available to you. So we'll go through all of these lines of coverage in detail. You will have access to your summary of benefits and coverage on your portal when you're going through and doing your enrollment in case you have any further detailed questions you would like to view on your summary of benefits and coverage. So the first thing we'd like to go through before we get into the medical plans is the difference in an embedded deductible and an aggregate deductible. For option one, which is the $3,500 deductible plan, it has an embedded family deductible. So this only applies if you are covering family members. But what the embedded deductible means is that one person will never exceed more than the individual deductible amount. Whereas on option two, which is your high deductible health plan with a $1,500 deductible, it has an aggregate family deductible, which means if you're covering more than one person, someone other than yourself on your medical plan, then you will have to meet the full family deductible first before the coinsurance will apply. And that would apply to any family member incurring claims. So we'll explain that in further detail as we go through that plan. For option three, it is a PPO $2,500 deductible plan. That plan does have office visit copays. It has an embedded family deductible. So again, if you're covering family members, one person will never exceed more than the $2,500 deductible amount. So the first plan we'll go through is option one. It is a high deductible health plan with a $3,500 deductible. So on this plan, everything does apply towards your deductible with the exception of, so when I go to the doctor's office, whether it's for primary care or specialist, I go to urgent care or the emergency room, all of those services will apply towards my deductible. Once I've reached $3,500, then Blue Cross will start paying the rest of my claims at 80%. Once my deductible plus my 20% coinsurance has equated to $5,000, then I've met my out-of-pocket maximum for the calendar year. So your deductibles and out-of-pockets will restart every January 1st. If you are covering family members, let's say I'm covering myself, my spouse, and 2 kids, and I have a surgery, then once I meet my $3,500 deductible, the rest of my claims are paid at 80%. Collectively as a whole, once all of our deductible expenses equate to $7,000, then it's considered met for the entire family. But because of the embedded deductible, one person's expenses will never exceed more than the $3,500 deductible amount. And then the 80% coinsurance will apply. and you will pay 20% up until you've reached your out-of-pocket maximum. Now let's go to option 2, which is a high deductible health plan with a $1,500 deductible. So if I'm covering myself only, if I have employee only coverage, then once I meet my $1,500 deductible, Blue Cross Blue Shield will pay the rest of my claims at 80%. Once my deductible plus my 20% coinsurance that I pay equates to $4,500, then I've met my out-of-pocket maximum for the calendar year. If I am covering family members, so anyone other than myself, so let's say again, I'm covering myself, spouse, and 2 kids, and I have a surgery, because of the aggregate deductible, I will need to meet that $3,000 family deductible first, and then the rest of my claims are covered at 80%. However, when my spouse goes in for an office visit, since I've already met the family deductible, then his claims are covered at 80% right off the bat. Once our $3,000 family deductible plus our 20% coinsurance equates to $6,850, then our family out-of-pocket maximum has been met for the year. On option 3, you do have office visit copays available. So for primary care, which includes internal medicine, family practice, and pediatricians, that's a $35 copay. All other physicians are in the specialist category, which would be a $70 copay. So with this plan, what applies towards deductible? Anything done in the hospital, outpatient surgeries, MRIs, CAT scans, things of that nature. In addition, with Blue Cross Blue Shield, physical therapy, chiropractic care, and occupational therapy apply towards deductible as well. So let's say I meet my deductible at $2,500. Blue Cross Blue Shield will pay the rest of my claims at 70%. All of my copays plus deductible plus coinsurance equate to $5,500. Then I've met my out-of-pocket maximum for the year. So if I'm covering family members on this plan, one person will never exceed more than the $2,500 deductible expenses. But collectively as a whole, if we all have expenses that are going towards deductible, then once we meet $7,500 in that family deductible, it's met for the entire family. One question I do get often is, do my copays count towards my deductible? And the answer is no. They will count towards your out-of-pocket maximum. So with your prescriptions, both option 1 and 2, your prescriptions are applying towards your deductible, just like all of your other visits, with the exception of preventive care. Always remember that preventive care is covered at 100%, regardless of which plan you're on. So you can go have your annual exam done and you won't pay anything for those visits. So for prescriptions, I would say this is the area where I see the biggest variation in cost. You can have a medication that is a couple of dollars or one that is thousands of dollars, depending upon what you're taking. So if you are new to a high deductible health plan and are considering enrolling in one of these plans, I would recommend going to goodrx.com in order to look up your medication that you take on a regular basis, just to find out, is it a low-cost medication or a high-cost medication? So it will not give you the exact amount you'll pay, because as your prescription is run through the Blue Cross Blue Shield system, you will receive discounts for that medication. But it will give you an idea of, is this a $10 medicine or a $500 medicine, just so you know up front before enrolling in the plan what you may be spending on a regular basis for your ongoing medications. If you enroll in option 3, you do have copays that you can see on the far right-hand side. So for preferred generic, you won't pay anything. For non-preferred generics, you'll pay $10. And then for preferred name brand, $50, non-preferred are $100. And then on your specialty medications, which generally can run in the thousands of dollars, you will pay $150 copay for your preferred specialty medicine or $250 for non-preferred. As a Blue Cross Blue Shield member, you do have access to MD Live for your virtual visits. So this is a great resource. It's an alternate for the emergency room or urgent care for those short-term illnesses that you kind of know what's going on and you just need a medication to take care of it. So if your physician that you speak to recommends a medicine, then they will call that into your pharmacy that you prefer, at which point your pharmacy benefits will apply. With MD Live, they do have behavioral health services. So you can see a counselor through the MD Live program as well. So depending upon the CPT code, those costs will vary. But for your option 3, you will just have the primary care office visit copay, whether it's for general health or behavioral health. But if you're on the high deductible health plan, this is a significantly lower cost option than urgent care or emergency room, can even be a lower cost than your primary care physician. So for those short-term medications, short-term illnesses, this is a great resource. For your Blue Cross Blue Shield provider finders, you will access that through the Blue Cross Blue Shield website. So once you're in the system, I encourage you to register there. It will take you directly to your network. If you are searching for providers before you're in the system, you will access the Blue Choice network, which is a nationwide network. But you also have a lot of good resources online. Once you are registered, you can use the cost estimator tools to find out different costs for various treatments or tests you may be having, but also you can see your explanation of benefits online, and there are a lot of great resources available to you. So how to avoid surprise medical bills. The easiest way is to avoid going to out-of-network physicians. However, we know that that can happen, especially with mental health providers, which we will go through a couple of examples of that in a few slides. But check your network to see if your physician is in network. When you're going to an in-network doctor, they cannot bill you anything more than Blue Cross Blue Shield allows. So for example, if I'm on a high deductible health plan and I go see my physician and they charge $200 for an office visit, but once it goes through Blue Cross's system for the discounts and is determined $125 is the allowable amount. That's the amount that applies towards my deductible, and that physician cannot balance bill me the difference. Whereas if I go to an out-of-network physician, they can charge me that extra $75 that Blue Cross said was above and beyond a reasonable amount. So I'm charged that full $200 for the bill because that out-of-network doctor has not agreed upon those discounts. So these are your costs on a per pay period basis. So you can see that information if you're covering family members or depending upon which plan you think you may be interested in. One thing to note is that for options 1 and 2, Lifeworks will contribute $50 twice a month into your employee health savings account. So if you're enrolled in one of the high deductible health plans, you will receive that $1,200 over the course of the year, which helps you pay medical expenses, things that are applying towards your deductible. So we're going to go through a couple of examples, particularly around mental health. Over the last couple of years, we have seen an increase in mental health provider utilization. So we just want to show you how this looks when you're going to an in-network mental health provider versus an out-of-network, because we do know many that have chosen to not be part of any health insurance networks. But if you are going to an in-network mental health provider, let's say you have 15 visits per year, and the contracted rate is $120 for that visit. You can see how much you will pay at the time of service when those dollar amounts are applying towards your deductible, or you're paying your office visit copay on option 3. And then you take a couple of medications on a regular basis each month, so you can see that cost listed. So you can see your total cost at time of service, and then factor in your annual premium. What am I paying to be enrolled in the plan? In addition, if I'm on a high deductible health plan, my employer contributes into my HSA, so I can use those dollars towards my expenses. So you can see your actual total cost factoring in all of those things at the bottom. Now let's say I'm seeing an out-of-network mental health provider. So I'm actually having to pay the full billed amount, but the contracted rate is what's actually applying towards my out-of-network deductible. And there is a separate out-of-network deductible. It's not combined with your in-network deductible. So you can see how much you'll be paying at the time of service. With out-of-network, even on option 3, that does go to your out-of-network deductible. There is no copay for out-of-network physicians. So you can see your total cost and then factor in your premium as well as your employer HSA contribution to see your total cost, your bottom line. So now we'll go on to your dental plan options. You actually have 2 different options to choose from, a low plan and a high plan. So where you'll want to see which plan is best for you, which will help you make an easy decision, is to see if your dentist is in network or not, or if you're willing to switch to an in-network dentist. Blue Cross Blue Shield has an excellent network of dentists. So you'll go to their website and look in their dental providers to see if your dentist is in network or not. If your dentist is in network, then the low plan can be a good option for you if you're not going to have lots of dental work or orthodontia care for yourself or kids. With this plan, there is a $1,500 per person calendar year maximum benefit. So everyone has $1,500 to use for dental services. The $50 deductible applies towards basic and major services, but your preventive care is covered at 100%. And then basic is covered at 80% after deductible, and major is at 50% after deductible. Your orthodontia care does apply to adults and children. So it's a 50% benefit up to $1,000 lifetime maximum. So that $1,000 doesn't restart every January 1 like your $1,500 calendar year maximum benefit does. But on this plan, the reason I recommend always staying in network with the low plan is because out of network, they reimburse on what's called a maximum allowable charge, which just means they will reimburse an out of network dentist the same thing as an in-network dentist. So I can be balance billed significantly more if I'm going out of network on this plan versus the high plan. And you can see your cost here at the bottom. But these are your high plan benefit options. So with this plan, it's a $2,000 calendar year maximum benefit. So you get a little bit more there. If you're having a lot of dental work done or a family member is, this could benefit you. The other amounts as far as deductible and coinsurance are the same. On your orthodontia care, it has a $2,000 lifetime maximum. So again, if you're going to get orthodontia care for yourself or your kids, this may be a better option for you to have that additional reimbursement. Or if you know you're going to see an out-of-network dentist, I would recommend the high plan just because on an out-of-network basis, they reimburse on the 90th percentile, which means 9 out of 10 dentists bill at or below what they pay. So your balance billed a lot less on this plan versus if you go out of network on the low plan. So check and see if your dentist is in network or not, and your orthodontist if you need orthodontia care, and that can help you determine which may be a better route for you to go. With your vision plan, you have a $10 copay for your exam. VSP will pay for glasses or contacts. They won't pay for both in the same year. It is one or the other. So you have a $30 copay for your glasses, and they'll pay up to $130 on your frames. If you find some frames that are more than that, then they will give you a 20% discount on the balance. If you opt for contacts instead, then you have a $130 allowance for your contact lenses. Also, an extra expense for contacts is the fitting and evaluation fee. So for that, you will just pay up to $60 on your contact lens fitting and evaluation. But for glasses, on those lenses, the lenses are covered in full, but if you have extras added, like scratch-resistant coatings or anti-reflective coatings, those extras are discounted but not paid in full. And your exam is covered every 12 months. So if I have an exam on September 1st this year, I'll be eligible for another one after September 1st next year. Same thing for my lenses or contacts, and then frames are covered every 24 months. So for your health savings account, we're going to go through the benefits of having a health savings account. This is if you are enrolled in option 1 or 2, because you have to be on a qualified high deductible health plan in order to be eligible for a health savings account. But what is a health savings account? It allows you to contribute pre-tax dollars for your medical, dental, and vision expenses for you and your tax dependents, regardless of if your tax dependents are covered on your plan here at Lifeworks. So if I am just covering myself, I can set aside money pre-tax, but also use those dollars for my children's expenses, even though my children are covered on my spouse's plan. For this plan, there's no use it or lose it provision. So once the money is deposited into my account, it's mine to spend. It rolls over year. So the funds are available once contributions are made. So let's say I have a big expense after I've only been on the plan for a month and I don't have enough in my account to pay for that expense. What I can do is just use another form of payment for that expense. Then once more funds are deposited into my account, I can reimburse myself at any point. So I can transfer funds from my HSA into my checking account anytime I need to, as long as I have the medical, dental, or vision expense to back it up. One thing you want to note is you'll only want to use those funds for dates of service based upon your effective date and going forward, if you're new to a high deductible health plan. So if I have some bills that I'm still paying on that were from a prior employer, or things that I had prior to becoming effective on the Lifeworks plan, you don't want to use your HSA dollars for those expenses, just for dates of service from your effective date and going forward. So like I said, you do have to be covered on a high deductible plan to participate in the HSA. You also cannot be covered by another health plan that's not qualified. So if you are covered here and then also by a spouse's plan that has copays, it makes it ineligible for you to contribute into a health savings account. Also, your employer cannot contribute into a health savings account because it makes it you unqualified. In addition, if you or your spouse is participating in a traditional flexible spending account, then you have to wait until that plan year is over before you or Lifeworks can start contributing into your HSA, because your spouse's flexible spending account dollars can be used on your expenses since you're each other's tax dependents. So Lifeworks does contribute into your HSA plan. It equates to $1,200 over the course of the year. And then you can also contribute into your HSA. Between your contribution and Lifeworks contribution, you cannot exceed the IRS maximums. So you want to take that into account as you're making your annual election. Also, hang on to all of your itemized receipts. WEX is the administrator for the HSA. They will not ask you for copies of receipts or explanation of benefits. It's your responsibility to hang on to those in case you're ever audited by the IRS. They are the only ones that will ask you for copies of those. So what I generally do at the end of the year is I log into my Blue Cross Blue Shield portal and I download all of my claims so that I have those on hand. So you can actually download a spreadsheet from the Blue Cross Blue Shield portal for your medical and your dental expenses. So that makes it handy. And then just keep your explanation of benefits for your vision care. Or if you've used your funds for over-the-counter medications or things that are eligible, then just hang on to those receipts as well. Now for your flexible spending account, this allows you to reduce your taxable income as well. If you are enrolled in option 3, then you can utilize the FSA for your medical, dental, and vision expenses. For the dependent care piece, it doesn't matter which medical plan you are enrolled in. That is for your children's daycare expenses. So we'll take a look at those maximums as well. For the healthcare FSA, again, you can use this for medical, dental, and vision expenses. So you're reducing your taxable income for expenses you're going to have. Since we are in a short plan year until December 31st, your maximum election during this short plan year time is $1,000, $187.50. So as a new hire, your deductions will be based upon your effective date through the end of December. You are issued a debit card so that you can use the debit card at the doctor, the pharmacy, the dentist, or your vision provider. The full election is available day one, so you don't have to wait until the money's been built up in your account before you use it. But it does have a use it or lose it provision. So any unused funds at the end of the plan year cannot be carried over. But you do have a $75-day grace period. So participants can incur expenses until March 15th, and May 16th is the last day to file claims for reimbursement. And that'll be done through the WEX website, so wexinc.com. For dependent care, again, it doesn't matter which medical plan you're enrolled in. You don't have to be enrolled in a medical plan at all. This is for your children's daycare expenses for dependents up to the age of 13. It does have to be work related, so both parents must be working or looking for full-time work if one of the parents is not working. So maximum election during this period is $2,083.33. Just keep in mind that if you or your spouse have set aside money pre-tax during the year, the IRS maximum is $5,000 per calendar year per household. So keep that in mind when you're making your election for the rest of this calendar year. So now we'll go through your life and disability benefits. Your life insurance is a $20,000 benefit. Also, you have $20,000 for accidental death and dismemberment should you pass away of unnatural causes. So this is at no cost to you. Lifeworks provides this benefit to you. Please remember to keep your beneficiaries up to date throughout the year if you do need to make a change. Now, as a new hire, you also are available to elect voluntary life insurance and accidental death and dismemberment with guaranteed issue amounts in place. So as a new hire, you can get up to $150,000 in coverage without answering medical questions. If you'd like to go above and beyond that, you can. You will just need to complete an evidence of insurability form that will go to Lincoln Financial Group to be approved or denied based upon your medical information. So Lincoln's underwriting department will view your evidence of insurability form to make that determination. But as a new hire, you will still get that guaranteed issue amount of $150,000. If you elect coverage on yourself, then you can elect coverage on your spouse and children. So the spouse cannot exceed 100% of your amount or $75,000, whichever is less, and guaranteed issue is $50,000 only during your new hire period. And then for kids, it's increments of $1,000 up to $10,000. So you will see your payroll deduction amounts as you go through the enrollment portal because it is based upon your age. Should you become disabled while you're an employee at Lifeworks, you will receive disability benefits. So for short-term disability, those benefits begin on the 8th day of an accident or illness, and you'll receive 60% of your income up to $1,500 per week. How long you receive the benefit is determined by your physician. So if your doctor has deemed you disabled for 11 weeks, then that is the amount that you will get. If it's a shorter period, then it just all goes by your physician's information. But if you're still deemed disabled after that 11 weeks of benefit, then it will go over to your long-term disability, which pays you 60% up to $7,000 per month. It can last up to your Social Security normal retirement age if your doctor deems you totally disabled that long. For your own occupation, what that means is if I cannot perform my own occupation, but I can do something else, then I will receive benefits for 24 months. After that point, I'll need to go do something else to provide myself some income. So it is based upon, the material duties of your occupation. Also for pre-existing, for the long-term disability, any conditions that are treated or diagnosed 3 months prior to your effective date will not be covered for the first 12 months of your policy, but everything else will be. And then for your employee assistance program, this is available to all benefit eligible employees and their dependents, anyone living in their household. So Lifeworks never knows who utilizes the resources, but wants to make sure that everyone is aware that this resource is available to you. It's a great program where you get up to 5 in-person counseling sessions per year, and that's per person and actually per issue. So, maybe I have a child going through a hard time at school and it needs to talk to someone outside the family. This is a great resource. They also have a lot of good resources online as well. So I encourage you to check out the guidanceresources.com site with your login information. Now we'll go through your accident benefits that are available to you. So your voluntary accident plan would pay you money directly in the event of an accident, such as, you're going to an urgent care visit based upon an accident. I recently enrolled myself and my son in this because he started playing football. So if he were to need to go have an x-ray or go to urgent care, they would pay me these funds directly. So they're not paying money to your provider like your medical insurance does. This is paying you a benefit directly. So when I go to take my son to urgent care and I'm having to pay money towards that visit because I've enrolled in the high deductible health plan, that amount is going towards my deductible. I am reimbursed from Aflac after I file the claim. I'm reimbursed $200 for that visit, so that can help me pay for my urgent care bill. For appliances, they reimburse up to $500. It's $100 for crutches, $100 for x-ray. So you can see the various amounts that you would be reimbursed depending upon the condition. The great thing about this plan is it has a $50 wellness benefit. So if you go and you have your wellness exam, then they'll pay you $50. So you don't pay anything for your wellness exam through your medical plan because it's covered at 100%. But on your Aflac plan, they pay you $50 per covered person per calendar year of someone that has their annual exam. So these are your costs, depending upon if you're covering yourself or dependents, and these are on a per pay period basis. If you do need to file a claim, please reach out to Connie and she can help you with that process. And then we'll go on to your critical illness. So this is also available on a voluntary basis. So for this coverage, it would cover you and pay you a benefit if you had invasive cancer, heart attack, stroke, or major organ transplant, renal failure. So you would could elect either the $10,000 benefit or $20,000 benefit. Your spouse will be have a 50% of your amount, and children 50% at no additional premium. So your children are covered under you. For spouse, there is an extra premium if you want your spouse covered. And then for skin cancer, it's a $250 benefit. But this plan also has the wellness benefit of $50. It's payable for yourself and your spouse once per calendar year. So that money can help you, in paying towards the cost of your premium. So this plan, it is based upon your age. And if you're wanting to cover your spouse as well, you can see that cost is based upon their age. So you can look at the $10,000 benefit or $20,000 and see your payroll deduction amount for this coverage. You have legal services available for you through Legal Shield. So this is also a voluntary plan available to you. I think it's a great resource. They are able to give you guidance on contracts up to 15 pages. What I think is really beneficial is the will preparation. I actually utilize them for my will prep, and they do your will, your directives, all of the forms that come along with your will when an attorney is putting all of those documents together for you. So they can do it for yourself and your spouse so that, your wishes are known should something happen to you. So you can see the cost at the bottom if it's for yourself or you're covering family members. It's a great resource. They utilize an attorney, a law firm actually based out of Fort Worth. But if you need legal representation on site, then they will hire an attorney in your area in which you live to represent you. So it also has ID Shield, which is ID theft services available. So they will help you monitor, they will be monitoring your name, date of birth, social, retail cards that you provide information to them on. Also, their social media monitoring. So an example of that is if someone posts that, you're going on a trip for an extended period of time. Well, that just notified everyone that you're not home for an extended period of time. So you would get a notification if someone tagged you and had let that be known. So they will help you in full restoration of your ID if it is stolen at some point, and full recovery and $1 million in protection policy. So this will just assist you with any incurred expenses as a result of ID theft. So you can see the cost here on an individual basis, or if you're covering family members, and then you do get a discount if you are enrolling in both. So this is your contact information for all of the different lines of coverage with the carriers shown. This is available to you in your benefit guide as well when you're doing your enrollment. And then you also have access to our Benefit Advocate Center throughout the year. So if you have questions as a new hire regarding the benefits, or throughout the year, maybe you have questions on claims that are incurred after you're on the plan, please reach out to the Benefit Advocate Center. There's a dedicated line and email address just for you all. So they have access to all of your benefits and can assist you with any questions or inquiries you may have. So with Alex, you are able to go online. It will help you in assisting which plan to enroll in. So it will give you recommendations based upon your input once you go into the portal. So it will give you explanation as to why that plan was chosen based upon your entries. And you can do a side-by-side comparison as well. So it's a great resource, a great tool to see which medical plan or dental plan may be a good fit for you and any covered dependents. So to enroll, you will go on to the UKG portal and you'll click under Life Events. There is a job aid posted here and helpful hints if you need any assistance during that process. But you will go to the Life Events tab and click on that as a newly eligible for benefits and to get started. Thank you so much and have a great day.